tell me if you think that tendons are special and they need special treatment, and that tendons take a longer time to heal than other injuries, and it's just really complicated, and you really got to be take your time and be really specific when you're treating tendons. If you believe that, keep watching this, because I'm going to tell you why tendons aren't the problem, why treating tendons don't fix the problem, and why tendon injuries and tendon overuse situations are easier to fix than you think when you understand that tendons aren't the problem. So I keep on seeing this on Instagram all over the place about how, take your time with tendons, and it takes longer to treat tendonitis, and it takes longer for ankle sprains to return. What if I told you that ankle sprains take less than a week, that tendonitis is really easy to get rid of, when you understand that those diagnoses are actually symptoms of the underlying root cause. And when you get to the root cause, you never have to treat tendons. It doesn't take forever. Your athletes don't have to miss weeks of practice. The issue doesn't come back. So here's the funny thing. All of these PTs are out there professing how long it takes for a tendon to heal, and how you have to do this on week 1 and this on week 3 and this on week 5 and then gradual return, and exposing the tendon to more activity. That's all fuckery when you understand that tendons aren't the problem. So when you understand that tendons have too much pressure put on them, whether this is an acute ankle sprain or this is an overuse injury like epicondylitis, tendons don't wake up that day and say, I'm going to be sprained, I'm going to be inflamed and have tendonitis. What happens is you have a root cause that is neuromuscular dysfunction. The muscles aren't controlling the joints. The muscles aren't unloading the tendons the way they should be. So the tendons have too much load over too much time in your chronic injuries, and the tendons have too much load in an instant with your sprains, which is causing the symptoms of tendon pain, tendon swelling, lack of range of motion, all that stuff. So if you reverse and you get to the root cause and you get the muscles that are dysfunctional to now be facilitated, they do their job, the tendons can do their job, and they're unloaded. So when you have a patient come in with a tendon issue, understand that the best way to heal that issue is to get the pressure off of the tendon. Electrical stimulation is not going to do that. Rest is not going to do that. Ice is not going to do that. Stretching is not going to do that. None of the old school PT fuckery treatments are going to assess the root cause and get the pressure off of the tendon. So when people tell me you can't get a grade 2 ankle sprain to return after a week, and I say, oh yeah, I can, because what I'm going to do first is unload the tendon that is injured by getting the muscles that didn't do their job to be facilitated, which is now going to take the pressure off of the tendon, and the tendon can heal much faster. Old school thought process would say, let's rest it, let's do this to the tendon, let's do that to the tendon. You never take the overuse and the overpressure off of the tendon. So as soon as that patient stands up and walks home, or goes up and down the stairs, or tries to do anything, that tendon once again is overloaded. So until you get the load off of the tendon is going to take a longer time to heal. That's why conventional physical therapists waste their patients' time for 4 to 6 weeks, no play, no do anything, because we're going to get this to calm down. Bullshit. Get to the root cause, get the muscles to be facilitated, that will unload the tendon. You can do more in the clinic with them. They can do more when they're at home, and you're going to teach them how to do more at home effectively without going too far too fast. But they're going to go back to play. And oh, here's the cool thing that I forgot to tell you before. How many times have you seen a patient for a tendon problem? You take all this time to get them to feel better and gradually return them to play and gradually give them more exposure to load. And 2 weeks after they're all better and they go back, they have the same problem again. Or how many of your ankle sprains have to wear tape, have to wear braces after they finish rehab? If your patients are wearing tape and wearing braces and doing all the symptom modification garbage after you release them to play, they're not ready to go back to play because you never got to the root cause. And the reason why you never got to the root cause is because they don't teach you that in school. And all of the gurus and mentors out there have no clue how to get there. So if you want to figure out how to unload the tendon so the tendon can heal while you are getting to the root cause and patients can get back to play in a week or maybe 2 weeks rather than 4 to 6 weeks, and how they don't have the injury reoccur, because when you get to the root cause, the injury is not going to reoccur. When you never get to the root cause and you just pacify symptoms for 4 to 6 weeks, the injury is going to come back because they have the exact same problem after 6 weeks that they had before 6 weeks, because you never learned how to address, assess, and reverse root cause issues. When you're ready to do that, make sure you DM me and let me know. I'll get you in the shift. We'll teach you all of that. We'll teach you why our ACLs come back faster. We don't follow protocols. They're jogging at 9 weeks. They're doing plyos after that. They're doing return to play. Now, are we returning our ACLs to play after 4 to 5 months? No, because we're still waiting for the graft to heal. But they have a normal facilitation, which means, guess what? The graft is unloaded so it can heal faster, and they're unloading the joint, which was the problem in the first place. And if you get to the root cause with ACLs, just like ankle sprains, just like epicondylitis, patients get better faster, they get stronger faster, they return to play, and they don't have re-tears and re-injuries, and they're not wearing braces because their clinician was an expert rather than a symptom modification gimmick person, because that's what they learned in school. So once again, DM me when you're ready to be an expert and you're ready to get to root cause and you're done dancing around tendon issues.